Welcome to Social Work Updates.
In this video we are going to talk about the evolution of social welfare in the Philippines during American period. The Americans occupied the country in 1899 and introduced the new educational system, new health methods and religious freedom. In 1902, following epidemic of bubonic plague, cholera and smallpox, then government created an agency named Insular Board to coordinate and supervise private institutions engaged in welfare work. This agency was composed of government health officials and therefore effective important programs in the health fields, such as the regulation of the practice of medicine, and the establishment of provincial and health boards to oversee the health programs of the government. The Insular Board also provided subsidy to expand the services of certain hospitals and asylums which were under its supervision. On February 5, 1915, the American government created the Public Welfare Board with the passage of Legislative Act No. 2510, essentially to coordinate the welfare activities of various existing charitable organizations. In 1917, Associated Charities of Manila was founded by a group of civic-spirited Americans and Filipinos, having in mind the concept of a community chest, as it is now called. The initial idea was to centralize the receipt and distribution of donations to different charitable organizations, the provision of material relief and employment to the deserving, based on a study of the conditions and needs of applicants. Between 1919 and 1921, the Associated Charities of Manila was fused with American Red Cross, but the arrangement caused administrative problems and had to be given up. In 1905, Philippine chapter of the American Red Cross was established to take charge of disaster relief in the country and to administer American Red Cross funds from United States. At the end of World War I, the organizers of the Philippine chapter decided to maintain the organization. In 1907, La Gota de Leche was established to furnish child-caring institution with fresh cow's milk from dairy farm in Pasay, Manila, supervised by a veterinarian. This agency later opened a free consultation clinic for mothers. In 1910, the Philippine Anti-Tuberculosis Society was organized, following the first meeting of the Far Eastern Association of Tropical Medicine in Manila. With aims of encouraging research and data collection about tuberculosis and combat the spread of the disease, the organization succeeded in securing government support in 1911, which eventually enabled the society to open a tuberculosis sanitarium. The sanitarium is still hospital for tuberculosis in the country today. In 1913, the Asociación de Damas Filipinas was organized by civic-spirited women to help mothers and their children, using funds obtained from membership fees and later fund granted by the Public Welfare Board. In 1926, the association founded a settlement house patterned after Jane Addams' Hull House. In 1921, the Office of the Public Welfare Commissioner was created under the supervision of the Department of Interior. It absorbed the functions of the Public Welfare Board, which, while charged with coordinating and intensifying the activities of child welfare organization and agencies, was unable to cope with the mounting problem in the health field, which was manifested in the high infant mortality rate in the second decade of the century. This office intensified educational campaigns, particularly along maternal and child health, engaged in studies to find out the causes of high infant mortality, established periculture centers and maternity houses, supervised private charitable organizations, and conducted conferences and institutions not only to heighten the health consciousness, but also to improve the knowledge and skills of the former, for their respective functions and tasks. In 1924, the Associated Charities had become an independent agency under the supervision of the Public Welfare Commissioner and was being partly financed by the government, and partly by the contributors. In same year, the Philippine legislature passed a law, Philippine Legislative Act No. 3203, relating to the care and custody of neglected and delinquent children and providing probation officers for them. In 1960, some of the children in the government orphanage in Makati were transferred to Welfareville, a 50-hectare compound supervised by the Division of Dependent Children in the Office of the Public Welfare Commissioner. The division introduced the congregate system, where wards were grouped in separate cottages based on certain considerations, such as the children's needs and problems. The same division supervised child-caring institutions receiving material and technical assistance from the government. The administration of social welfare in the Philippines was marked by significant development when Frank Murphy became the Governor-General in 1933. Scholarship grants were made available. The legislature appropriated funds for the operations of government child and maternal health centers. Social health centers were also established. He also created First Housing Committee, which undertook a study of slums in Manila. He also encouraged the establishment of private colleges and technical schools and had the National Economic Protectionism Association organized to promote home industries aside from National Research Council. He also created an unemployment committee and supported women suffrage campaign by signing a law enacted by the Philippine legislature enfranchising women in 1933. In 1930s, Dr. Jose Fabella was a director of Office of the Public Welfare Commissioner. The latter was done with the help of Jose Jara Martinez, the first Filipino who obtained a diploma in social work from New York School of Social Work in 1921, who worked for the Public Welfare Board and started to introduce scientific approach in social work. The Murphy administration's social welfare programs marked the first time the government assumed full responsibility for the relief of the distress due to any cause, and for the Commonwealth period. Please watch part 3 of the video.
And that's it. Thanks for watching. For more social work updates, please visit my YouTube page, hit the bell and subscribe.